Tuberculosis is the second deadliest infectious agent, claiming the lives of 1.3 million people globally since 2002. This despite it being a curable disease. South Africa is a global hotspot, being one of the 30 highest TB burden countries.
If we look at the numbers of people that are affected by TB, it's one of the main causes of death in our country. It's approximately like 468 per 100,000. So we know that that is very significant. And 60% of those patients are actually suffering from HIV as well. So it's so important to get out into the community and make them aware of the symptoms and aware of the testing opportunities that are available. And most of these are free.
In South Africa, currently we've got around 11,000 people who are having MTR-TB, of which you all know that it's very difficult to treat the MTR-TB, and it becomes more expensive to treat the MTR-TB. So out of that 11,000, we still have 5,000 people that are not yet to be enrolled on the treatment. So these are some of the realities that we are facing on the ground.
From shorter medication regimens to advanced technology, the country is constantly innovating to treat TB.
We're approaching the fourth industrial revolution. There's these new dynamic testing systems and treatment systems that are available. And in order for us to actually stand and fight this disease together, we are going to have to lean into those. We're going to have to embrace them fully and take on this technology in order to help us diagnose and treat. And it's helping us to be more effective, more efficient, and overall actually getting to those TB cases.
Despite the country being a leader in new tools to test and treat TB, it sees a high mortality rate.
We really need to declare TB as a public health emergency if we don't practice this. That's why last week we had a march. Part of the things that on the march we are calling to is to meet with the department, to sit down with the Department of Health, to sit down with the Department of Finance, to sit down with the presidency and discuss these issues further, so that we can also come with solutions to say these are the solutions that we feel as civil society need to be applied.
People are struggling with resources, with transport, and of course our vulnerable homeless communities and drug-using communities. There's still a lot of work that needs to be done.
This year's theme is Yes, You and I Can End TB.
So events like this, where NGOs are partnering with departments of health, are so important, because I don't think any one of those two divisions by themselves can actually make a proper impact. But when we're standing together and offering services together, that's when we're going to make our great strides.
Health activists are calling for TB programs and initiatives from government to community levels to continue beyond just this day. Hasina Gori, SABC News, Sedibeng.